Hi, I'm Dan Leonard in the East.
And I'm George Whittam in the West.
And together we are
East-West Audio Body Shop.
Oh, excuse me. I gotta tell you something. Sinusitis is a problem for a lot of people in the voiceover business, and making his triumphant return to EWABS to talk to us about rhinosinusitis is the amazing Dr. Joel Bernstein, and he'll answer your questions about your ear, nose, and throat problems.
I'm going to talk about the Chaotica Eyeball. You've probably heard some reviews about this thing online. I'm going to show you this thing because I'm going to have one coming home from the Voiceover Atlanta event where I am right now, and I'll be able to give you my completely neutral review over this product and tell you what we really can get out of it.
Completely unbiased. And in my tip of the week, I'm going to talk about those great presets that you find in all our software programs. That's East-West Audio Body Shop, Monday night, 9 o'clock in the East.
And 6 o'clock in the West.
And make sure you get in the chat room. It's getting busier and more fun all the time. We'll see you there.
He's the home voiceover studio engineer to the stars in Los Angeles, California. A Virginia Tech grad whose knowledge of the latest recording gear is second to none. He's a voice actor and the home studio master, hailing from Buffalo, New York. His home studio skills and knowledge of voiceover recording is unmatched. When Dan and George talk shop, people listen, and the talk continues tonight. Welcome to East-West Audio Body Shop. And now, live from his high-tech facility in Santa Monica and his penthouse studio in Buffalo, here are George Whittam and Dan Leonard.
Good evening. I'm Dan Leonard in the East.
And I'm George Whittam in the West.
And together we are East-West Audio Body Shop. All right. A little less delay there, I guess.
Yeah, we're getting there.
Yeah, well, okay. Well, if it's pixelating on you a little bit, that's just the way it is.
Sorry. Tonight we're opting to sacrifice some video quality to improve the audio quality because the audio tonight is brought to you by IPDTL, IPDTL. So if it gets a lot worse on you guys, maybe we'll bail on IPDTL because the extra load on my machine to do that is pretty hefty. So yeah, we'll go for it. And if it gets worse, we apologize. The video recording hopefully will be much, much better that you can watch later on YouTube.
Yeah, it's a humping and it's a pumping.
We really max out the capabilities of a 3-year-old Mac Mini pretty heavily on this show.
That thing is 3 years old already?
3 years old. It's a 2000.
You were using an iMac before or something like that.
Yeah, and a MacBook, an old MacBook Pro. Yeah.
But by the way, this is actually our official third anniversary. We started March 22nd, 2011, if you can believe that. The technology has improved so much in that period of time that now we're just we're actually finally using an alternative audio source.
The more things change, the more things stay the same.
Stay the same, absolutely. Well, we've got a great show as usual, like we do every week. Great guests, great topics. This week, one of our favorite people, Dr. Joel Bernstein, will be joining us and talking about rhinosinusitis. So even though I was thinking about calling it sinorhinositis, but we would probably have a diplomatic incident if I called it that. Anyway, so we'll be joining Dr. Bernstein in just a little bit, but we got lots to talk about. First off, you were in Atlanta. Quickly, how was Atlanta for Voiceover Atlanta?
I'll try to keep it to 30 seconds, but
30. Good luck. All right.
Yeah, let's make it a minute. Starting now. I thought it was overall a very nice event. I thought it was well run. The people all seemed very happy with it. I never saw anybody melt down. I didn't see people getting frustrated. You know, when people all generally are happy, that's always a good sign, and that was the way this event seemed to feel, and it had good vibes. It was a nice size too. It was more on the scale of FAFCon than it was on the scale of, say, the big voice conferences that James and Penny do. So obviously it's newer. It's in a much smaller market. But being that way, it's more intimate and people get more attention, and it's I don't know. I thought it was a great size. Everybody seemed to really enjoy it, and I had a great time socializing with folks late at night, well into the morning, most nights until 2.
That's where the most fun is at those things.
Yeah, and then waking up at 7 a.m. on Saturday for a workout with Zurich. He was there. He's a certified personal trainer now, and he did a group workout that, I mean, it's probably closest related to Taibo, one of those kickboxing workouts. It was serious. It was a serious workout, man. It was no joke. So we had a great time.
Yeah. So one of the things you got there, and you've been like bragging about how you got this thing. It's this ball thing. And tell us all about it.
Yeah. Well, I first saw this thing. It's called the Chaotica Eyeball, and I first saw it at AES in October last year, and I recorded a little clip about it. And well, they decided to sponsor VO Atlanta and make sure that all the presenters got to take one home, which I thought was a very smart idea to get them in a lot more hands. So, in full disclosure, I was given one, but I'm still going to try to be as impartial as possible about it because, well, that's just the way we are around here. So here it is. This is the Chaotica Eyeball. This is what it looks like when the grill is on, or actually not the grill, but the pop filter. It's a really clever design. I'll take the pop filter off and show you. So it has a large opening in the front. It's about 5 inches, I'd say. And you can see it's sort of, it's a cylindrical shape. So the outside is a sphere. The inside is a cylinder. Then at the base, that's the microphone opening. So as long as your microphone is larger in diameter than that hole, it should fit pretty snug in there. So in this case, I've got this MXL 1006, very, very similar in size and shape to most other large diaphragm condenser mics, like a U87 and that kind of thing. And so it should fit on most mics of that kind. The pop screen is this disc with blue fabric, and it is sort of like, it literally looks like a piece of pantyhose that's been tied off in the back. Well, I mean,
I'm
that's
sure
all.
It's higher quality.
Higher quality, I'm sure, but I mean, it's just a sheer fabric, and it's double sided, so you have a double layer pop screen here, which is pretty cool. And normally you'd pay at least $30 or $40 just for a double layer pop screen, so factor that into the cost. So these things, I believe, retail now. I mean, when they came out, I think they were $200, but they may have dropped to in the $150 range on the street, so to speak. So what does this thing do? What's the whole point? The whole idea is that what it's supposed to be doing is taking the space around the microphone and acoustically drying it out, or deadening or dampening the area around the microphone. So it should change the response curve of the mic. It'll change the pickup pattern and the response curve of the mic. That's basically what's going on there. So, all right, enough blabbing. Let's see what it really does when it's on the mic.
See what the proof is in the pudding.
So while I'm going to mute the mic because the sound of me sliding this over the mic will be pretty horrible. So while I'm doing that, Dan, you can tell me what you think. What are your preconceptions about what this thing might do while I do this?
Well, what it's supposed to do is it acts as a damping system for a lively room. So if you're on the road in a hotel room or something, it should, in effect, reduce some of the room slapback that you have in there. Whether it removes side noise or creates side rejection is a good question. So I'm fascinated to hear the final product here.
So it's in the mount. I'm going to twist the whole thing. Hang on a second. I twisted it around on camera so people could see what it looked like when it's in there. So now it's actually facing me. So now I had the mic before. I had the mic sideways. Actually, I'll keep it sideways to be consistent because that's the way I do it on the show. So the ball doesn't block my face quite too badly.
I don't think that anyone's bothered by that. So.
Very funny.
Don't give me a line. Don't feed me like that.
There we go. See, is that better now? It's blocking my face entirely. So there it is. It's a little bit below me. It's not the way you normally position a mic for VO, but anyway, it's about the same place that it was before. But, I'm just curious to see if, at least over Ip Diddle, which is pretty good quality, do you hear any kind of dramatic difference in the way my voice sounds?
Zero.
Yeah. I think in this particular situation, it makes very, very little difference, if at all. I wasn't using a pop screen before, so I haven't put one on. I can pop the pop screen on to see if you can hear a difference. There we go. So that's with the pop screen on, but it should have very little, if any, difference at all, right? Because it's just a very thin layer of fabric. So anyway, I mean, there's the Chaotica Eyeball. So what is it doing here? I mean, it's supposedly changing the pickup pattern of the mic. I think it's only going to make a significant difference if you really use the mic closely, but it's not making the dramatic difference that you might, or at least maybe I was expecting. A lot of the samples that I was hearing from other folk and the people on the website, it seemed like they were using the mic like they were talking right up at it with, really
that's
close.
Not how you use it.
Yeah, and that makes it sound, well, if you want to make your nice condenser mic sound like an RE20, go for it. That's basically what it's doing. So,
what you're saying is that standard condenser mic rules still apply.
I think so. Yeah, absolutely. Yes, it changes the tonal characteristic of the mic a little bit. It colors it a little bit. If that color is something you're looking for, cool. It's another little paintbrush in your box. But otherwise, it's not. One of the things we were hoping it would do would be knock down background noise. Well, I recorded a sound sample on SoundCloud, which we'll put in the show notes. I've already put it in the chat room for the folks there, but I will put it there again for the folks that tuned in later. But the noise floor does not go down. If anything, it may have slightly gone up because this thing now acts as a sort of a parabolic reflector and kind of increases the sensitivity of the mic from the front, which then means the mic picks up the noise that's in front of it, which means the noise floor maybe even goes up instead of goes down. So the noise floor didn't really seem to go down in this case. Now, my room is already pretty well acoustically treated. So that's another purpose of this thing. And so maybe if I was to test this in a less than ideal space, we'd get a better idea of what it's capable of doing. Because that is really, I think, its primary goal is to knock down more acoustical reflection around the microphone. So, there's more of these going out into the field. I'm really curious to hear what your feedback is if, for those of you that do have one and or are going to get one. See what you think and see how it works for you. I know one of our buds, Cliff Zellman, who's in our chat, not our chat room, but he's in our Audio Masters Roundtable. He finds it to be really helpful in his room. So he may have a more live room, and this may deaden it down a little bit. So
maybe
I'll take it off again.
Okay. And Ip Diddle just took a dump.
No, it's just me muting my mic.
Oh, I'm sorry.
I just don't want you guys to hear all that noise.
Oh, okay. So he's now taking it off of there, and I found it fascinating that it's there was a lot of hype to this thing, and it's marginal at best. I mean, it might reduce slapback, maybe 10-15%, maybe 20%.
Yeah,
Would you say that's about right?
Yeah, I mean, I think it's one of those tools where it will help people in certain scenarios. Let's say you have a room that's pretty well damped, but not very, very well damped, and you want the room to be a little bit more dry. This could be awesome. Slip it onto the mic, and you've now made your room less reverberant, more dry sounding. But if your room is already pretty damp to begin with, like mine is, it won't make much difference at all. If your room is very live, let's say you just put this on your mic in your office, or even worse, a bathroom. Yes, it will reduce some reverberation, but still not enough. So you'll still need to use other things. So it's not a one-stop miracle solution. Marginal, but not miracle, as Dan said earlier. I thought that was a good way to put it. It makes things marginally...
I wrote marginal. It just came out magical from this stupid keyboard of mine.
But it was well... I mean, it makes it marginally better. 20-30% even, but it depends on your use scenario. So there you have it.
All right.
And I had it squished into my carry-on.
Well, that's the best part.
I mean, it was really squished. And when I got home, it took about 10 minutes and it re-expanded. And you could put your mic that you travel with in this thing and squish it down in your bag, and it becomes a nice protective thing for your mic too. So it's pretty cool. It's compelling. If you got a little bit of money to play around with and you want to give it a shot, I'd say I would say if you were going to say don't buy, try, or buy, I would say try.
Okay.
There you go.
And that's the name of that, too.
Yeah.
All righty. Well, we got lots more coming up. I've got my tip of the week coming up, talking about some presets. And Dr. Joel Bernstein will be with us in just a couple of minutes. So get all those sinus questions down and get them into the chat room so Anthony can get them down. And we'll talk all about what goes on up your nostrils in just a little bit. So stay right where we are. We'll be right back here on East West Audio Body Shop.
VO Studio Tech. Recording made simple.
Hi, I'm Peter McHugh.
This is Jim Tasker from Los Angeles, California.
Hi, this is Bill Ratner in Los Angeles.
Hi, this is Scott Rummel here in Yorba Linda, California.
Hi, my name is Rick Wasserman.
Hi, this is Tom Kane.
Hi, my name is Vanessa Marshall.
Hi, my name is Zurich.
Hi, I'm Mary McKittrick.
Randy Thomas chiming in.
Hi, this is Joe Szymanski.
Hey, this is Rick Robles.
Hi, my name is John Patrick Armstrong.
I was turned on to George by none other than Don LaFontaine, who always swore by his health.
George is absolutely awesome.
ISDN, Source Connect, Phone Patch, FTP, you name it, George has set it up.
It's really the best thing I've ever done for myself. I feel free, safe, fearless, like anything is possible in here.
Unless you like to look for opportunities to waste time, call George.
And he did all of that, long distance over the phone and the internet.
I'm very happy with George, and I cherish him.
Thanks, George. You make it easy.
Hey, honey, I bought you a new suit.
Oh, no. What fancy function is it now with all those hoity-toity people? What are they?
But, dear,
Is this for your work? Please don't tell me I have to sit with your BB again. Boring boss. If I have to,
No, it's not that.
Wait, is your sister getting married again? This is like her 4th or 5th time, poor guy. Somebody should warn him about...
Would you just listen?
I'd take any of these over the theater. Please don't make me go to another one of those over-the-top musicals you love so much. They just...
Okay, fine. I'll send it back. I think Dan has a return policy for his studio suits. I'm sure the UPS guy is still outside and he'll take it
Dan?
back.
Studio suit? Wait, honey, I didn't mean any of it. I love getting dressed up with you. Your boss is fascinating. Your sister is a catch. Honey, baby. Cats. That's it. Let's go see Cats again. That was my favorite one.
God, I hate cats. Midnight and the kitties are sleeping.
It's kind of dated, too.
I know it is. Anyway, well, see, now we got the singing. We got the singing in.
Dan, we're not going to sing.
We're not singing tonight.
We promise.
It's not going to happen. Not going to happen. All righty. Anyway, Dr. Bernstein will be joining us in just a couple of minutes here, so get those questions down. But I got a fascinating conversation about rhinosinusitis. He brought models and all sorts of stuff. This is going to be absolutely fabulous. All righty. Tip of the week, so we can get rolling here and get to Dr. Bernstein ASAP. You know all those presets that you got in your software? Let's roll that, and we'll just go with it.
This is where I'm going to have to edit the show, or we're going to have to riff, because of all the things I did before the show, I didn't find the tip of the week video.
Oh. Should I find it?
Which one? Let me see.
Presets.
Okay. Let me go into presets.
Forgot my tap shoe. Sorry.
It's just called presets, right?
Yes.
There it is.
And there it is.
And dragging it in and dragging it out behind the barn. Here we go.
Hey, honey, I bought you a new suit.
Oh, no.
If you're new to digital recording, or recording at all, you're probably confused just by the word processing. You know the terms: EQ, compression, noise gating, normalizing. But how do you learn what to use and when? There are some shortcuts that can help you along. It's just like your favorite restaurant. They have standard fare that you know and love. They hit on what you like and consistently deliver it. Recording software is no different when it comes to processing. Most of the recording and editing software we use has presets. These are predetermined filters and effects designed for our specific purposes. When you open an effect, There'll usually be a drop-down menu with all the presets for that certain effect. Also, you can make adjustments and save those adjustments as a customized preset. Even the simplest and cheapest software has presets. Audacity clearly is limited with only a few adjustable parameters in some of its effects. If you're on a Mac, though, Audacity has all the Apple effects, the AUs, and some of those have more presets. For example, for reverb, it will give you a selection of different size rooms to recreate an appropriate reverb or echo. When you move up to more sophisticated software like Audition, you get lots more choices when it comes to presets. You get different compression schemes, dynamic, processing, and the like. The best part is they have names that describe what each does. For example, it has de-essing and de-shing presets for both male and female voices. The Dynamics processor has over 30 presets, ranging from a broadcasting limiter to my personal favorite, Voiceover. There are several gating presets too that make setting up a noise gate much simpler. There are also some mastering presets that tell you exactly what they do. Plus, there are tons of plugins that you can find simply by doing a search for what you want, like a simple noise gate plugin or a certain type of distortion to make your voice sound creepy, or a phaser, or chorusing to multiply your voice. Each site explains how to install them in your plugin directory, and when you open the effects rack, it will be listed there. Some are free, some are not. So how do you learn to use them? As I tell everyone after I teach a concept, go out and play. But as we talked about with front-end processing, with effects in post, it's non-destructive filtering and editing that is not permanent. You can easily restore the file to its original sound. So ease your processing learning curve and end your confusion. Explore your presets and how they can make your audio sing. And that's my tip of the week. If you're new to digital recording, or recording at all, you're probably confused.
Oh, why? Here we go. We're back.
Okay.
We're back.
Okay. Are we back? We're back?
Yep.
Back. All right. Yeah, but my number one thought about that is, if you don't know what something does, you don't need it and don't use it. I mean, most of that stuff is to play around with and stuff. Unless somebody specifically asks you for an effect like that, you got no business messing around with this stuff.
Yeah.
You know, I mean, a couple of things. Maybe a little compression, maybe a little bit of gating, that sort of thing. Maybe a little bit of EQ just to, balance things out a little bit. Little tiny maneuvers.
Subtleties.
Subtle little movements.
If anybody notices you're using an effect on your voice, that's the kiss of death. Unless you are a voice producer. If you're a producer, have fun. Right. That's your art. That is part of what you do. But if you're a voice actor, unless you are vying to be a producer, don't start dabbling with this stuff and using on a job unless that's part of the job description. So have fun, but be careful.
Yeah.
Be safe.
Yes, that's right. Be safe. Anthony says he has his broadcast quality plug-in. Well, we won't be talking to Anthony for a while now. Anyway.
Do you remember that Far Side cartoon where it's a picture of a sound guy in front of a rock band? And you can see over his shoulder, and it's a mixer. And he's reaching for a knob, and the knob says suck. And he's about to turn the suck knob. Well, if you don't know what you're doing with processing, almost every one of those controls is a suck knob. So be careful what you're doing.
All righty. Well, that's going to do it for the tip of the week, and if that's not enough. Anyway, Dr. Joel Bernstein will be joining us in just a moment, so don't go away. The best part of the show is coming right after this. Stay where you are.
This is East West Audio Body Shop with Dan Leonard in the East and George Whittam in the West. Now, back to Dan and George.
And we're back!
I love coming back when Dan's scrambling with his mic at the very, very, very last second.
Yeah, we just had to adjust a couple of things here. Anyway, it is time for Roland Flick for his triumphant return. Welcome back, Dr. Joel Bernstein.
Is that Roland?
Hello, Dan. Thank you very much.
Roland Flick, yes. Roll and Flick.
Dan, tilt your camera down a little bit. Frank, give you guys a little bit more.
How's that?
There you go. Great.
That?
Perfect.
That work? That
That'll
works?
work,
Okay.
yeah.
And I'll move back. So
then you can settle. You can settle in there.
That's right. Okay.
Make you more comfortable.
Anyway, we're going to talk about something that is vitally important to voice actors everywhere, and that's this area between their ears and behind their nose. Am I close?
Absolutely.
All right. Well, we're going to talk about rhinosinusitis and various other things. So tell us about rhinosinusitis. Now, you brought some models with you, too, so I can't wait to see all this stuff. But
well, first of all, Dan, I want to make sure that the people listening understand that the sinuses are defined as air-containing cavities in the face. And I'm going to actually use you as a model, Dan. Okay. Each sinus is defined by the bone in which it's placed. So this is the maxilla, so it would be called the maxillary sinus.
Okay.
Take your glasses off, Danny, for a second. In between the eyes is the ethmoid bone, so we have the ethmoid sinus.
Ethmoid.
Above the eyes is the frontal bone, so this is called the frontal sinus. And then in the middle of the head, there is a sphenoid bone, and it's called the sphenoid sinus. Most of them are paired, so actually we have 8 sinuses, 2 maxillary, 2 ethmoid, 2 frontals, and 2 sphenoids. Now, normally these are air-containing cavities which communicate with the nose through a very, very small, narrow opening. When that opening gets blocked by a viral infection, and viral infections play a role in probably 98%. That is correct, 98%. And it's therefore called, because it involves the nose initially, it's called rhino, because rhino is the nose, sinusitis. And it's called viral rhinosinusitis. Then approximately 5 to 8 to 10 days later, if the blockage persists, bacteria invade the sinuses, and then it becomes a bacterial sinusitis, which requires initially antibiotics.
Initially?
Yes.
Okay. And how do you determine which antibiotics to give somebody?
Well, if you're really a good doctor and you look up the nose and you see red, pussy material, you can culture that and identify the specific bacteria, send it to a bacteriology laboratory, and get a specific antibiotic to which the bacteria is sensitive to. But in reality, Dan... few people do this.
Okay.
Because there are antibiotics which cover most of the bacteria that invade the sinuses, and there are really only 3 major bacteria. And, for example, amoxicillin, augmentin would be the drugs of choice in people who are not sensitive to penicillin. If they are, you would go to a different antibiotic, such as Levaquin or Ceftin, cefuroxime acetyl, and so forth. But right now, I just want to make sure that the people understand that viral infection precedes everything. And for the first 5 days, you should not be on an antibiotic because by that time, it's only a viral infection. And in general, viral sinusitis goes away with no treatment in about 10 days.
By itself. Eventually, your immune system says, get out of here. And
Dan, as usual, you are absolutely correct.
Of course I am.
In a normal person with a normal immune system, the viral infection subsides in 10 days to 2 weeks. But if there's pus coming out of the nose and the patient has pain, fullness, pressure, pain in the teeth, a lot of postnasal drainage, then most doctors, both specialists and general physicians will put the patient on an antibiotic that's appropriate. And I would recommend that if you're not sensitive to penicillin, Augmentin, Augmentin is the drug of choice. I don't want to go into a scientific explanation, but amoxicillin may only hit 50%. So if your doctor puts you on amoxicillin and you're not sensitive to penicillin, ask him to be placed on Augmentin. Okay?
All right. So what are some, I mean, we were talking about bacteria and stuff like that. How does it get in there? I mean, your nose is designed to do all sorts of cool things like warm air and clean the stuff going into your lungs. And I studied this stuff in high school.
Did you read about this?
I read about it in high school, and I didn't forget. It's been 30, 40 years since I was in high school. Yeah. But I remember, what does the nose do? It warms the air, it cleans the air, it gets it ready, it moistens the air so before it goes into your lungs. Okay. So it's probably a fabulous breeding ground for bacteria.
Well, actually, the nose itself is mainly sterile. The bacteria that get into the sinuses actually come from the back of the nose, which we call the nasopharynx. That's where in children the adenoid is.
Right.
And even in adults, that's where most of the bacteria come from. So if you have a viral infection, your immune system is trying to get rid of it. But, when you have a viral infection, you got a runny nose and you're sick.
Yep.
And once that opening of the sinus, which we call the ostium, O-S-T-I-U-M, becomes blocked, there's no oxygen anymore in there, and you've got a beautiful breeding place for bacteria that come from the back of the nose, invade that area that's not ventilated anymore. Bottom line is a normal sinus needs to have ventilation and drainage. And if you can ventilate the sinus with air, and you can drain the sinus by allowing the sinus to drain out, because it does have a small mucociliary system and it does make a little bit of mucus, then you're not going to get infected. So the way that you get infected is by the virus occluding, closing off that very tiny space, and then bacteria invading from the back of the nose.
Now, some people say they have chronic rhinosinusitis.
Okay,
that's
a good question, because now you're talking about what are the three types of sinusitis?
What are the three types of sinusitis?
Number one, acute sinusitis. By definition, lasts about a month. Subacute, 1 to 3 months. Chronic sinusitis, by definition, lasts for more than 90 days. That is the accepted definition by the American Academy of Otolaryngology / head and neck surgery. So if people continue to have postnasal drip, pain in the face, pain in the teeth, yellow-green nasal drainage, fullness, pressure in the face, for more than 90 days, we call it chronic sinusitis.
Yes.
Okay?
Or what we refer to here in Buffalo as winter.
Okay. Yeah, right. So there's a good question. That tells us what the three major types are. Acute, where you get a sudden onset of severe pain with purulent, pussy drainage in the nose, and all of those other symptoms I mentioned.
Purulent.
Caused by bacteria. Subacute, 1 to 3 months. Chronic, more than 3 months. That's the definition.
It makes me want to grab for a tissue right now. It's interesting how these things start up, because this is something I wanted to talk to you about. Because those of us in the voiceover business, you get a cold, you get something like this, or sinusitis, sometimes you're out of business, because your voice is going to be affected by this.
Well, that's a very good question. I think I demonstrated this last time, and I want to see if I can demonstrate it again.
Okay.
Let's say a person has a really bad cold.
Okay.
And you have swelling of the tissues in the nasal cavity.
Right.
Now, if I block my nose completely, Dan, I want you with your ear to listen to my quality of sound.
Okay.
I'll even sing a note, okay?
All right.
Now, I'm going to sing ah, and then I'm going to close my nose tightly as if the nose is totally blocked, and you tell me whether or not there's any significant change.
Significant change.
Okay?
We'll use the Chaotica Eyeball after that.
Is there any difference?
Slight difference.
But not very much.
You can hear a slight difference in resonance.
Yeah, it was not very big.
As a matter of fact, to me, you're right. I could hear it better by bone conduction. The point I'd like to make is that when you have a viral infection of the nose alone or the sinuses alone, the voice doesn't change that dramatically. But what you have to keep in mind is that the virus infection may also involve the back of the throat and the vocal folds. And if you get edema and swelling of the vocal folds along with the sinusitis, you say it's the sinus problem. It's really the entire upper respiratory tract that's becoming inflamed, swollen, and that's where you get voice problems.
Yeah, and it happens to all of us. I mean, it's tough because, as you say, it's like 10 days, and slowly your voice gets better.
Absolutely. I think the point I want to make is that sinusitis alone may not alter the voice dramatically, but sinusitis, rhinitis, which is a cold, and then it goes down. Very often a person has a cold and then all of a sudden it goes down, and 2 weeks later they have a laryngitis, right? And It's a viral laryngitis. And you don't treat that with an antibiotic. It'll go away by itself. And you have to rest your voice, drink a lot of fluids, take vitamin C, and hang in there.
Yeah. Now, I've noticed that if I've got a cold, and I don't get many of them anymore, which is something else I wanted to ask you about, but if it's in the back of your throat and you're still able to talk, it's the coughing that seems to get your vocal folds to start swelling or something along those lines, because that's when I start to have trouble. Is when I start getting a drip, I start coughing, and the voice goes.
Okay, well, what you're saying is that now the inflammation is not only coming back down the throat involving the vocal folds, but it also may go down into the trachea, causing a viral bronchitis, and that's when you start to cough.
Right.
And as you continue to cough and the vocal folds are hitting each other, the vocal folds become even more edematous, more inflamed, and the coughing plus the viral infection now makes your voice that much worse.
Oh. Now, you brought a model here. So let's show everybody this great model you got.
Well, this is a model of a half a skull, and
we can bring it a little closer here.
Show me where I can place it.
Right in front of the camera here.
So we talked about the 4 different sinuses. The one above the teeth here is called the maxillary sinus.
Can you tilt down,
and then
Dan?
The one by the eye in here is called the ethmoid sinus.
Oops, sorry.
And then
Better, I can see a lot better now.
Middle section, as we call it a sagittal section. Here's that sphenoid sinus. And why is that sinus so important? Because the optic nerve comes through here. You hit that, if you go into the sphenoid sinus and you hit the optic nerve, you cause blindness.
Ooh.
Also here is the pituitary just above it. Many neurosurgeons will go with an ear, nose, and throat doctor through the nose to remove a pituitary tumor. And the other thing that's in here is the carotid artery. And if you happen to hit the carotid artery, the patient's going to be dead in about 30 seconds. Okay? Yikes. And sometimes people have isolated sphenoid sinusitis. Now, if you know the anatomy, you know how to get there, these complications don't occur. So I know we're going into surgery, but in chronic sinusitis that doesn't respond to multiple antibiotics and corticosteroids, prednisone, anti-inflammatory drugs, sometimes we have to operate. And there are 2 types of diseases that we operate on. Chronic sinusitis and, very important, chronic sinusitis with nasal polyposis, which is an area that I've researched for a long time. And if you operate, you have to be careful of 2 things, the eye and the brain. And those are the 2 potential life-threatening complications. So for those of you out there who have chronic sinusitis, get yourself into the hands of a competent ear, nose, and throat surgeon who has experience operating with inside the nose.
What would you do as surgery? Well, to relieve the problem?
Well, we remove there's another word that we have to mention.
Okay.
Once the bacteria and the virus have done something to the lining in the sinuses, you get, and this is a very important word, Dan, and I can't emphasize it enough, inflammation.
Yep.
And what is inflammation? It's the body's response to a bacteria, virus, or fungus. Incidentally, fungus has plays a role in patients who are immunocompromised, who have AIDS, and who don't have a normal immune system. But in general, bacteria and virus play the major role. Fungus probably less than 5%.
Yeah.
And so the question is, when do you need surgery? When you're not responding to medical therapy for a long period of time and the patient is symptomatic and unhappy, can't breathe, congested, has a tremendous amount of mucus going down the back of the throat, causing a cough, like you said,
right,
and has discomfort, pain, fullness, pressure, and nothing seems to help. So that's when you go in, and as I said before, the object is to take out the inflammatory response, which is the body's mechanism of trying to ward off the infection. But long after the bacteria and the virus have gone, the inflammatory response remains, and that's what causes all these symptoms. And so what you're doing is going in there and removing the inflamed mucosa and providing good ventilation. And in general, the surgery is very successful.
All right. What about prevention? I think that's probably a really good area to talk about because, all of us we're professionals. We need our voices. They've got to work at all the time. How do you prevent this sort of thing from happening? I know that when I've got a cold coming on, I feel it coming on, I'll start reaching for stuff like Zicam and zinc and things like that. It seems to help. But what's the better way? Obviously, washing your hands is probably a good one to start with.
Well, I think
Tilt up again, Dan?
that is a very difficult question to answer because what you're saying is, how do I avoid getting a cold?
How do I avoid getting a cold?
I can't answer that question.
Darn.
What you do is you avoid people who are sick. And if you have young children, they're going to school, they're bringing back viral infections, and you get infected.
Tell me about it.
But what you said, zinc, which is Zicam, can be effective. Drinking a lot of fluids, vitamin C. But, as we said before, once you get that viral infection, there's not a lot you can do. To prevent viral infection, you'd have to live in a sterile environment, and that's impossible.
Right.
So I don't really think I have much to offer in the way of prevention, because if everything starts as a viral infection, which is 98% of the time, I don't know how I can advise people to prevent being exposed to a virus. And certainly
they're everywhere.
In Western New York, as you know, this has been a very, very bad winter, and there's been a lot of influenza, a lot of flu, and these people are very sick.
Does it affect your hearing at all?
In general, sinus disease and middle ear disease can be caused by the same virus or bacteria, but one doesn't cause the other. Anatomically, the sinuses are in the face, the middle ear is past the eardrum. But the reason why it could be related is because they can be caused by the same virus or bacteria. But all I'm saying is that at one time, when you get the infection in the nasopharynx, back of the nose, it can go up the eustachian tube, causing middle ear infection, or it can go into the side of the nose, getting into the sinuses. So you could develop a middle ear infection and sinusitis at the same time, but one doesn't cause the other, but they're caused by the same virus/bacterial infection. That's the best answer I can give you.
That's an excellent answer. Okay, well, do we want to go to a break, George, and get to some of these audience questions?
Absolutely.
All right, well, We'll take a break, and we'll be right back with Dr. Joel Bernstein right after this.
VoiceOver Extra, the voiceover industry's online news, education, and resource center 24/7. Hundreds, probably thousands of free how-to articles for voiceover success, ranging from home studio to voice acting to business. A free voiceover industry directory, calendar of industry events, resource links, a store, and much more. Bi-monthly webinars on all topics of voiceover, free subscriptions to newsletters, reports, announcements, daily news, and features at voiceoverextra.com.
And now, back to East West Audio Body Shop, where every week it's Apollo 13.
All righty. We're back with Dr. Joel Bernstein here on East West Audio Body Shop. And boy, we actually had questions before we even started. Everybody knew you were coming. So let's see what people have to say here. Starting off, this one was an interesting one. Rebecca Michaels, who I don't think is actually listening. She's in Italy, isn't she?
Italia.
See.
Yeah.
Is it true that honey can really help soothe a slightly sore throat for us voiceover actors or singers or other people that use their voices?
Mm-hmm. As we say in Yiddish, it wouldn't hurt. I don't know of any particular. Study that's ever demonstrated that honey, is adverse to being taken. I mean, I don't think this is a scientific type of thing I can answer. It doesn't hurt, and I mean that. In other words, if it helps the person, fine. But there's no studies out there that objectively tell us anything about the role of honey in sore throat,
right? Except
to say it's warm, it's soothing, and as we said many times before, these are viral infections, and they go away with the patient's immunity. So I don't really have a good answer for that, except, as I said before, it certainly wouldn't hurt.
It certainly wouldn't.
We got a lot of questions, but I do want to follow that up. Sorry, Joel. We have a lot of questions, but I do want to follow that up. And I don't, pardon me for maybe opening a can of worms, but you said that there's no studies on that. Why? I guess would be the question.
The International Honey Institute doesn't want to do one.
Well, I guess that's the point. Does it take somebody to...
No. I don't think it takes a study to do it. It's just that, when you get a viral infection, you need your immunity, right? Mm-hmm. The lymphocytes, and they take care of the virus. If you get a bacterial infection, your own immune system takes over. So the question is, what does honey do? I don't think any ear, nose, and throat doctor is going to give you any scientific answer because I don't think there are any. There's no articles written on the role of honey in producing decreased soreness in the pharynx or back of the throat. I think it's the kind of thing that your mother would do to make you feel better.
Yeah.
And I'm not saying that it hurts at all, but I'm just saying that there's no scientific data to support an important role for honey and sore throats.
Mm-hmm.
Unless you can show me something, but I don't know of anything.
Yeah, no, I was just curious why there wasn't any studies. I mean, we've had honey for as long as we've been human, probably. Really? Diana Birdsall, question for the good doctor. I've been seeing an ENT for a throat problem that has persisted for over a year. Irritation, inflammation in my throat never goes away. Feels like a constant lump of phlegm that I can't get rid of. The doctor says it's probably LPR reflux and has tried every spray and acid medicine out there to no avail. Also went on the GERD diet. 4 months now, no luck. Any thoughts? Ooh, that's pretty specific.
That's pretty specific.
Well, it's very interesting. I agree with her ear, nose, and throat doctor. That would be the first thing I would think about would be LPR. LPR stands for laryngopharyngeal reflux or high reflux. Now, reflux is acid that comes up from the stomach. And if she's failing with the ear, nose, and throat doctor, the first thing I would do is I'd recommend that she see a gastroenterologist because if it is GERD, and apparently she didn't say she was on any medications like, for example, Nexium or Prilosec, which is over the counter. What these drugs do is they decrease the hydrogen ion concentration in the stomach. And so the first thing I would think about is exactly what her otolaryngologist said, that she has high reflux. And if it doesn't help to take the medications, I'd still want to follow up with that diagnosis because that is the most common cause of recurrent sore throat. It also causes cough and it also causes voice changes. So that would be my number one thing. Other things that could cause pain in the throat would be postnasal drainage, which is our subject today. She might have a chronic sinusitis, and the ear, nose, and throat doctor has not done any CAT scan, which incidentally we didn't mention in the initial evaluation. when you think you have a sinus problem, objectively, you've got to get a computerized x-ray to confirm it. If the sinus x-rays are normal, then sinus disease is ruled out. So I would say there would be two diagnoses that I would think about. One, she already has been given reflux, high reflux, LPR. And the second thing would be postnasal drainage coming from either the nose or sinuses. I certainly would look into allergy as a third possibility. I think those are the three things I would evaluate. Okay?
All right.
Well, we got a lot of questions, so we're going to try to move, and I love your answers. You can talk as long as you want, Dr. Bo. We don't want to wear you out.
He's had a long day.
We've got a lot of so we're going to try to maybe move them along quicker.
Okay.
Amy E. Fisher, sinus is the sinus is very connected to the teeth, gums, and mouth health. No?
No.
That's an interesting way of saying these are all very important and they're interrelated. So I guess that's what she's saying.
Well, let me put it this way. I would look at it the opposite way, George. I would say that patients who have had dental surgery, for example, removal of a third molar by an oral surgeon, an implant, which may go into the upper jaw and into the maxillary sinus. One of the most common causes of unilateral, one-sided maxillary sinusitis is an implant or the removal of a wisdom tooth, which leaves a tract, and oral bacteria get into the sinus and can cause maxillary and ethmoid sinusitis. Okay, the other way of looking at it is sinus disease almost never causes dental disease, but it can produce pain in the teeth.
I've had that pain in the teeth. I was starting to wonder what I should have checked out, but at the time I was dealing with some sinus issues, so they're related. Good to know that.
Well, remember, the floor of the maxillary sinus is right above...
Hold it way up high, close to your face.
The floor of the maxillary sinus is right above the teeth.
So the pressure is going to go on.
Right.
So if you have infection in the floor of the maxillary sinus, the roots of the teeth go into that sinus, and so you're going to have dental pain.
Makes total sense.
Makes total sense. Next
Suzanne?
one from Sam Roberts. Yes, go for it.
Oh, okay. Here's a sinus question. How does he feel about the natural remedies for sinus things, which we talked about a little bit, but we're even talking about more like fresh grated horseradish.
Which is great for Passover, but is it good for your sinuses?
Well, again, this is an anecdotal kind of stuff, and if you understand the anatomy of the sinuses, if we had a CAT scan and you realized how narrow the ostium is that goes from the lateral wall of the nose into the sinus, it's so narrow that the question is, do these natural remedies open that area up? I would say that rather than natural remedies, I would suggest the following. A nasal spray, the possibility of a steroid nasal spray, the possibility of a decongestant. Those are all over-the-counter medications, but I really would have that patient go to an ear, nose, and throat doctor for the appropriate diagnosis. You know, one of the things that bothers me so much about patients asking questions is that you can't treat a disease until you have a diagnosis. So once you have a diagnosis, then you can give proper treatment. Going back to the original question, I don't know of any objective studies that have shown that these remedies like horseradish would reverse a sinus infection, which is caused by a virus and or a bacteria. So I don't really have enough information to answer that question.
Well, thank you, though.
But I've noticed that Chinese mustard is really good if you have a sore throat.
And it can blast a hole right through anything in your nasal cavity. That's for sure.
This is true.
Jerry Reed says, this is hopefully pretty basic.
We'll find out.
When sinus is full or congested, why does it affect the sound of your voice that comes from your throat?
Well, you know, it's very interesting. There have actually been very few studies that have documented what she's saying. But I will tell you this, that one of the physiological functions of the sinuses is that there is some evidence in the literature that a normal sinus improves the resonance of the voice, so that if you have, and you'd have to have significant blockage of many of the sinuses, that it could affect the resonance quality of the voice. Because if you've got large ventilated air-containing sinuses and you're directing the sound, let's say an opera singer or a pretty good singer, the sound, it hits the hard palate, radiates into the sinuses, which are air-containing, which increases the resonance of the sound. So I think she's absolutely correct. When there is blockage of many of the sinuses, it can affect the quality of the voice.
Is that like an extreme version of that would be, you ever get a bubble that gets, there's some sort of a bubble that gets somewhere in the throat area, and all of a sudden your voice goes from here to up here, and there's a bubble in my, let me get that out of there.
And I've heard you do that before.
Isn't that weird?
Well,
where's that happening in your face?
I think that's more of a bubble coming into the vocal fold and maybe preventing the vocal folds from coming together properly.
Okay.
Rather
it's such
than
a weird sensation.
A sinus thing. Yeah. George, just cough it up.
Yeah, just cough it up. Move on.
All right.
Karen O'Brien and Lee Penny together are asking, are nasal polyps due to allergies exclusively? And if left untreated, could they create any serious conditions?
Okay. I am... Please don't... let me put it this way. This is my area of expertise, so I can really answer this question. I've been studying nasal polyps and publishing on nasal polyps and doing basic science research on nasal polyps for over 20 years. The answer is that allergy probably plays a role in about 25%, so that the great majority of patients with nasal polyps are not allergic. That is a fact. Number two, nasal polyps come in all varieties. A single polyp, multiple polyps, humongous polyps, polyps that completely fill the nasal cavity and the sinuses. This kind of problem, I believe, has a genetic basis. We've also proved that. So why is it that people with the same bacteria, the same fungi, the same viruses, most of them don't develop polyps and some do? And I think the answer is there's a genetic predisposition, because even when we operate on these patients and remove almost all of the disease, there's a very good chance in about 30% that the polyps will recur. So are they dangerous? If they grow, they can grow toward the eye, and they can actually cause an immobilization of an eye because it can involve a muscle, an extra a rectus muscle, which moves the eye back and forth. If the polyp grows superiorly, it can erode the base of the skull and cause meningitis. But these are very rare complications. And going back to surgery, those are the things that the otorhinolaryngologist, the ear, nose, and throat surgeon, has to be very aware of, by knowing where the base of the skull is and knowing where the eye is, because the ethmoid sinus is right next to the orbit. And if you go through that paper plate, as it's called, you can destroy vision, you can injure a muscle, you can develop eyelid ecchymosis, black and blue. So the rhinologist has to have good training, have a lot of experience. And I'm glad that you asked the question on polyps, but the reason why people get them is most likely a genetic background.
Fascinating.
Joe, you or Dan, pick a question too, but I got one already lined up that I really want to ask that somebody else has already asked, so I will ask it too.
Well, there's one from Devox.
Do that one.
Yeah, it's nasal irrigation. How to do it properly.
Okay. Nasal irrigation with salt water is a wonderful thing to do for people who have dry noses. It's also healthy in general. It stimulates the mucociliary system, which what Dan was mentioning before. One of the functions of the nose is it has small hairs called cilia, which brush the mucus back, which are produced by mucus serous glands in the nose, and they go down the throat. How much mucus does the nose produce a day, Dan?
I think you've said upwards of a quart.
This guy should have been a doctor. That's
My
exactly
mom wanted
right.
me to be one, actually.
It's approximately a liter, 1,000 cc's of mucus a day is produced by the nose. And so where does it go?
Where does it all go?
We swallow it.
We
swallow it. So when people say I've got postnasal drip, I say everybody does. But those who have postnasal drip have obviously more. They're conscious of it. They have chronic sinusitis, nasal polyps, chronic rhinitis, allergy. So the question here is, how do you irrigate your nose? Well, you know, if you go to your pharmacist, and in most ear, nose, and throat doctors' offices, we have tons of little bottles, and there's no trick to irrigating the nose. You do it over the sink. You take a tablespoon of salt in a quart of water, warm it up, put your face over the sink in the bathroom, and just go up. It'll go in your nose. It's like a neti pot, you know. It goes in the back of the nose around, and it flushes out excess mucus.
So the neti pot's a nice way to do it.
But there's one potential complication, George, and that is when the neti pot is used, it can go into the back of the nose and go up the eustachian tube and cause a middle ear fluid. So you got to be very careful. My recommendation is to irrigate the front of the nose over the sink with your head down. It'll go up and down. And the purpose is to simply lubricate the nose. That's all you're doing.
Okay.
Yeah. What about some of those commercial saline things that are just a spray
That's
bottle?
fine.
Yeah.
That's fine.
Yeah, simply saline.
A lot easier.
It's so funny how they're marketing salt water now, but I guess if we market bottled water, we can market saline.
More expensive than gasoline.
Well, you can make it for nothing. You take a tablespoon of salt, quart of warm water, and it doesn't have to be sterile. The nose is not sterile, so you just flush your way.
How about Kevin Schuler asks, what about probiotics as a preventative? Do you have any knowledge on probiotics? Are they really helpful in this particular situation?
Well, probiotics, by that, the definition of a probiotic is something like taking, material that actually is in the gut. That's where probiotics are primarily. I mean, they help diarrhea, they help GI problems.
It's more of a digestion thing.
It is. And yogurt, for example, would be a liquid, not liquid, but yogurt would be a great example of a probiotic. Because what does it have in it? It's got bacteria in it.
Cultured, yeah.
And when people have diarrhea and they lose a lot of the intestinal bacteria, that's when you want to refill it with yogurt, which are probiotics. But I don't think there's any evidence that probiotics are effective in either the elimination or the prevention of sinus infection.
Gotcha. Okay.
Because you're taking it by mouth.
Right.
And it doesn't affect the rhinosinus area. That would be my answer.
Yeah. Now, this next one here is an interesting question from Shelley Evelino and Martha Kahn, John Oak.
Whoa.
They all have the same one. Talking about, and I have my own opinions about this stuff.
Okay.
Homeopathics. Have you looked at any of the research on homeopathics for dealing with colds, like
Dan,
Ryan and some of that stuff?
I can't help these people. I have no knowledge of this. I'm sure there are people who do it and get good results. I have nothing against it. I just, most people who are like myself, who are hardwired to have data and science back them up, I would say that I don't have an answer for it, but that doesn't mean that those kinds of herbal vitamins and so forth couldn't be very helpful. So I would say absolutely, I'm not against it. I just don't have any evidence to support it. Doesn't mean I don't think it would help. It just means that I don't have any data to support that kind of approach.
I guess they're not harmful. So they're
I'm sorry, George.
Homeopathics are not inherently harmful if taken carefully, right? So I
agree.
You could try them. I mean, if you want to experiment on yourself relatively safely, I guess you could treat yourself homeopathically one time, and maybe the next season you get sick, then go, more of a allopathic route.
George, I want to emphasize that I have nothing against that kind of approach. And if it works for the patient, great. Yeah. I just don't have any objective evidence to say it, and it certainly would not be harmful.
I can say we've treated our last few seasons of flus and colds with homeopathics in my household, and a combination of some herbal things. And it's taken an average of 2 to 3 weeks to get through the entire, thing. And they usually run their course in about 3 weeks.
Well, that's the whole point. What you've just said is that's when a viral infection runs its course anyway. So how can you, if you have no control group, how can you possibly say it was the herbal medicine that helped you? That's the point.
Yeah, that's true.
Makes sense.
You want to pick another question, Dan?
Yeah. Steve Gonzalez asks, is there a way to get rid of constant congestion while living in a humid, oak pollen-filled environment?
Move.
Oak.
Move. That worked for me, man. I moved. You live where you choose to live. When I was in hell in Pennsylvania in the spring, it was horrendous. I moved out here. I've been much happier.
George and Dan, you've answered the question. Obviously, this gentleman may have some type of allergy to the material in the, not so much the wood, but who knows what's behind the wood, and if it's a very warm environment. These are things that are conducive to develop rhinitis. And I would say that allergic rhinitis would have to be ruled out. I would probably recommend that he go to see an allergist.
Mm-hmm. Okay. Should we get one more in there, Dan? I mean, I don't want to have him overstay his welcome. We want to have him back to answer another 50 questions in another 6 months.
Exactly. Well, this is an interesting one because this has to do with OTC stuff, like something like an 8-12 hour.
That's over the counter.
For you people wondering what OTC stands for.
All right, I'm glad that somebody brought that up, and I want to make sure that people listening listen very carefully. Afrin and neosynephrine are vasoconstrictors. They constrict the blood vessel and open the airway. But they also cause rebound. And unfortunately, most people do not read the little tiny font letters of the directions. It says very specifically, do not use for more than 3 days or consult your doctor. Now, probably every year, ear, nose, and throat doctors see dozens of people who have abused over-the-counter medications for nasal obstruction. And that's where saline irrigations would be more healthy and beneficial. So if you're going to use Afrin, please don't use it for more than 3 days, twice a day. Neosynephrine, no more than 3 days, 4 times a day. And if you don't get any help by that time, see your physician.
All right.
Thank you.
All right. Well, they're all just piling on here, but we don't want to keep you because you're a busy guy, and you probably 2 more questions.
Yeah,
two more questions.
All right,
2
man.
more
you heard
questions. All righty. Let's pick a good one here. Let's see. Here's a good one from Anthony. For the surgery you described for sinusitis, what are the best places in the USA to have that done if necessary? Because he's way up in the Upper. He's up in
where is he?
He's in upper Michigan, upper Michigan. But he's
well, I have a very good friend in Birmingham, Michigan, which is just outside of Detroit. And every major city has very competent ear, nose, and throat doctors. And I would call the county medical society. I don't want to give the doctor's name over the air here, but I do know a very dear friend that I've published 2 papers with who lives right outside of Detroit. So if you can get yourself into the Detroit area, ask for an ear, nose, and throat doctor, and make sure that he has experience and has done a lot of sinus surgery. This is not the type of surgery that you want a beginner to do. The anatomy is very sophisticated. It's very dangerous surgery if you don't know what you're doing. So make sure that you pick an established doctor who has a lot of experience.
All right.
Thanks for that.
All right, now there's two good questions here.
Okay.
Two more really good questions.
Okay.
One from Martha Kahn, and because this one I know a lot about, not personally myself, but I know someone's got this problem. How do you feel about eliminating inflammatory provoking foods like wheat, sugar, and dairy? Does that have any effect on your sinuses or your mucosa or anything like that?
The answer to that question is only if you're allergic to those materials. I don't think by themselves they cause acute inflammation. I don't know where that's coming from, but I would say that if that bothers the patient and causes nasal obstruction, nasal congestion, and rhinosinusitis, then we're dealing with nasal allergy to the food. And that has to be looked into.
All right. Last one from Chris Hughes. Why don't you do that one, George?
Yeah, question. What about medicine-induced sinus
Wait a second.
Hold on. Uno momento.
Go ahead. Medicine-induced?
Well, yeah, Chris Hughes asked about, what about medicine-induced sinus problems, such as lamictal causing constant stopping of the nose? I have to constantly use nasal spray. Will this hamper my voice or will it cause problems in the long run? Ooh, that's a loaded question.
Well, let's take each part of that, George. The first part is medicine that causes nasal obstruction. Is that correct? Something like that?
That's what I understand is the way it's written, yeah.
Okay. I'm sure there are medications, and one of the most common medications, and this may be interesting for all of you, one of the most common medications that causes nasal obstruction are antihypertensive medications.
For high blood pressure.
For high blood pressure. So what happens is that, as you know, if you get vasodilation, which is one of the techniques of lowering blood pressure, you're going to get significant swelling of the blood vessels, which will cause swelling of the tissue. So he's absolutely right. There are medications that can cause it. And the classical one are patients who are on antihypertensive medications. They frequently come in, but unfortunately, we can't really take them off the medication because their primary care physician has got them on it. Maybe they can reduce the dose and so forth. But yes, there are medications that can reduce. And remember, it's very, very simple. The nasal mucosa is full of blood vessels. And if you dilate those blood vessels or stimulate the nerves that dilate the blood vessels, you're going to get nasal congestion. So what you need to do is go on Google and find out, does this medication increase vagal, V-A-G-A-L, tone, or does it cause dilation of the blood vessels? Because it's only dilation of the blood vessels that causes nasal obstruction. And that's the best way I can answer that question.
Wow. Thanks for taking us to medical school tonight, again.
Yeah, again. Well, Dr. Joel,
thank you.
Pleasure having you with us tonight.
Thank you.
And I figure people are, if you have any questions for Dr. Bernstein, address them to me, and I'll take the best ones. And when I have to go in there to have him check my sinuses, I'll say, okay, this guy asked this. This guy's great. He saved my life. So if he can save mine, he can help you out too. But you have any publications or anything that people might be interested in?
Well, if they actually went on Google and looked at my name, Dr. Joel M. as in Marvin Bernstein, and nasal polyps, I think you'll run across about 25 articles that I've written over the last 15, 20 years.
Yeah, but not many pictures of him. You know how hard it is to try and find a picture of you?
I've got pictures on my computer. I don't know where they're there.
I think the M is the key. You got to get that M.
Well, you got to use the M.
You'll have to help me get my picture on that, okay? Because I've got 3 pictures.
Okay.
You got it.
We'll do that.
Okay.
All righty. Well, can we take a break here? Or
yeah, let's take a break.
Okay, we'll take a break, and we'll be right back. Thanks for being here.
My pleasure.
Always a pleasure to have you.
Thank you.
We'll be right back.
You're watching East West Audio Body Shop with Dan Leonard in the East and George Whittam in the West. They're nice guys, but every time I'm there, they never let me make water. So I'm going to go make water right now. I'm a grown man.
If you have studio problems, bring them here to EWABS. Let's get back to more problems with Dan Leonard and George Whittam.
And now back to the only webcast done with 2 cans, 2 geeks, and a string. East West Audio Body Shop with George Whittam on his end in the West and Dan Leonard in the East.
Well, how great was that, huh? Oh, now I've got dogs barking. It's like chaos around here. I hear a dog barking and a door knocking. Probably time to wrap up this show pretty quickly. But while Dan says goodbye to Joel over on his end, let's thank Harlan, our long time 3 years running sponsor of the show. Harlan, we love you. Thank you so much for being a part of the show for so many years. Let's talk about his wonderful products over at voiceoveressentials.com. Dan?
Yes. I have returned.
What's new at VoiceOver Essentials? Have you heard of anything new lately, or is Harlan just keeping up with the demand of sales over there these days?
It's just a madhouse over there because everybody wants the VO1A, probably one of the best economical voiceover microphones you can have. You're hearing my dulcet tones over it right now. I shouldn't call my own dulcet tones, but people say, Dan, we want to hear your dulcet tones. Well, you're listening to whatever they are on a VO1A, the Harlan Hogan Signature Series microphone. If you don't have one, great extra microphone to have. Great. If you're going to go on the road, you don't take your TLM 103 with you on the road.
Hey, you need a stunt mic, as we say.
You need a stunt mic, and it's a great mic because it's a great value, but it sounds really, really good.
Yeah.
So I highly recommend this particular
Have you done an A/B with that and the TLM just side by side or in the same?
I have not. I have not.
Maybe try that for one of our upcoming shows.
I think we shall. Maybe we'll get Harlan on and do that so he can prove it. We can wear alchemists' hats and stuff like that. That would be interesting. But yeah, so there's that, and of course the Harlan Hogan Signature Series headphones, the ABS for those of you. Now I've got the big boom up tonight. This is the big guy.
Oh
because, yeah, and if you've got a heavy boom mic like that and a heavy microphone, you need the ABS, the adjustable boom strap, or adjustable boom jock strap, as I like to refer to it as. It's a great thing. A lot of times you don't want it drooping. You just put this thing on, it holds it up, and it's custom designed, and it's fabulous. So go on over to voiceoveressentials.com because you can find everything you could possibly need for voiceover. If he doesn't have it, you probably don't need it. That's right. Anyway, thanks, Harlan. You've been with us all 3 years we have been here with East West Audio Body Shop.
We love you, Harlan.
Absolutely. All right.
Dan, you got really short all of a sudden.
I did?
Tilt your camera down a little bit.
Oh, okay. That a little better?
That's better. I don't want you to look like a Oompa Loompa next to me.
I'll just hold my breath until I turn blue, and then we'll really have something.
The Viagra straps, Lee said.
Grow up, you kids. Come on now.
My God.
All righty. Where were we? Oh, okay. Are we in our announcements?
We're
here?
well into the hour, 20-minute range here. So we'll blaze through these announcements.
All right. Well, let's see. Did we talked about our donors yet?
No.
Oh, okay. Well, let's see. Eric Aragoni, thank you. And everybody else who's been donating here
Daniel
and there.
Wallace made a donation for a clicker.
From Grants Pass, Oregon. Didn't
you.
think I remember that, did you?
Jeffrey Chambers, thank you.
Yes, right. If you haven't gotten your clicker, if you've ordered one, I got a big order going out, so you'll be getting those pretty soon. But they're $5. They are great. I have found they are fabulous if you're breaking up slides and stuff like that.
Mm-hmm.
That's an interesting sound.
Yeah. I think the hounds have been released, and when I mean hounds, I mean my daughter.
Okay. Anyway, Yeah, but these are great for marking slides, and you can see it real easily on your waveform. But you guys all know that.
That's right.
Let's see. I have 2 videos coming out. I've got a video on Audacity Basics with VoiceOver Extra with a live Q&A, and on April 8th, I'm going to be doing a live Q&A with that. It's only $39. Go over to VoiceOver Extra. And then with Voice 123, on April 1st, I am doing a webinar on Home Studio Basics, my legendary Home Studio Basics webinar. So if you've been watching this show for a while, maybe you don't need that. But if you got somebody who really wants to know about home studios, that's a good one to go watch. So go over to Voice 123 and you can sign up for that YouTube channel. Tell us about our YouTube channel, because I'm still trying to figure it out.
YouTube.com/EWABS show. One word, EWABS show. So just go to /EWABS show and you'll see all the new shows that we've posted in the last month, and channels and playlists of all the old shows from previous years. It's all in one place where it's really easy to find. And
all 3 years.
And if you ever get confused about all these different places we are, just go to ewabs.com. Enough said. It's
the mean lean homepage for East West Audio
There's
Body
a tab
Shop
there for the podcast. So if you're an audio person, then you're probably already listening to this. But if not, then you'd rather listen to it this way, because when these shows get long, listening in the car might be the way to go. Check out the podcast version. EWABS Essentials, we've started putting those out. We're going to
Whose turn is it this week?
It's way my turn, I'm sure. So I'll probably get one up soon. Those are our little short tidbits from past shows that you guys might find useful. So if you can't stand an hour and 20 minutes sitting on the sofa watching YouTube on your iPad, that might be something else for you guys to check out.
We pick out the best stuff for you.
Yeah, the best stuff.
Yeah.
So I'm going to let you take over so I can kick my daughter out of the zone of...
be nice.
No, I mean,
okay.
Extract her.
Oh, okay. There you go. All righty. March 31st, that's next week. It's the end of March already, if you can believe that. My buddy Joe Davis, who is a voiceover webmaster, a voiceover website webmaster. We're going to talk about voiceover websites and basic, HTML and all this other stuff, talk about SEO, things that you guys all want to know about and go, huh? Joe's great at describing that kind of stuff, and he'll be a great guest. Also, April 7th, our Voice Actors Roundtable. We're going to have some of the best coaches in the business in our roundtable format. We've got Mark Cashman and Elaine Clark and Ellie Ray Hennessy and Randy Kay. And they're going to talk about what you need to do as voice actors these days. So we'll go from websites to voice acting. Pretty good.
What do you think of that, Ella?
All right, she's totally underwhelmed. Hi. Okay, hi there. All right, and then on April 21st, I will be in Southern California, and we're going to have our 3rd anniversary party show / Dingus Day show. So it's going to be at the VoiceOver Peeps headquarters, and we'll be sending out invitations for that very shortly. So we'd like to see you there, especially if you get invited. I'd like to thank our sponsors once again, of course, Harlan Hogan of VoiceOver Essentials, VoiceOver Extra, and your fine employer, Edge Studios.
Thanks, Edge. You're awesome.
Yeah, all right. Okay, please like us on Facebook, follow us on Twitter at @EWABS_show, and subscribe to us on YouTube, and like the new channel, like the videos. Go watch the first one. Go watch episode 1 of EWABS.
See how far we've come.
See, yeah, it'll totally freak you out. Also, yes, we'd like to thank Ella for being here at this time. And, of course, we'd like to thank our wives for putting up with this. And we'd like to thank Dr. Joel Bernstein for joining us again tonight. Also, our producer, Kathy Curridon, Anthony Gettig for his help in the chat room, Jack DeGolia for his help with the show notes, Jason Lawson, who we hope is doing better, and Lee Pinney for his production assistance.
Way to stick it out with the end credits, Dan.
Why, thank you very much. Oh, you're running the end credits?
No, I mean just all the
she's the end credits.
The
okay.
Show would seem to go on forever.
All righty. Well, you guys had stuck it out for this whole hour and a half. We love you. Thanks for joining us every week. And that's going to do it for us. And we'll see you next Monday night, the 31st, Joe Davis will be our guest. Anyway, I'm Dan Leonard in the East.
Say I'm Ella in the West.
I'm Ella in the West.
And together, all of us are East West Audio Body Shop. Have a great week, everybody. We'll see you next time.
See you next time. Bye.